Hi, and welcome to the Good Health Podcast. I'm your host, Nicole Good, a registered nutritional therapy practitioner and functional medicine practitioner. Join me as we explore thyroid, brain, and fatigue conditions with positivity. From Hashimoto's to multiple sclerosis, chronic fatigue to adrenal dysfunction, I've got you covered. With expert advice and tips to help you take action now and inspiring real patient stories from successful individuals who refuse to let their health hold them back. Start your journey to good health today. And don't forget to come and join the conversation on Instagram at good_health. That's GOODE. Or visit my website at nicolegoodhealth.com to find out more. Welcome to today's episode of the Good Health Podcast. I'm your host, Nicole Good, the founder of the Good Health Clinic. And today I'm joined by Sam, a fellow practitioner who also works with thyroid conditions and chronic fatigue. Together today, we're going to be looking at 4 major root causes that might be hindering your healing. So if you are doing everything to help yourself, you're working on your diet, you're working on your lifestyle, but you're really not seeing those improvements that you'd like to see, one of these might be the reason why. So today, together, Sam and I are going to be jumping into trauma, infections, viruses, and mycotoxins, and how these might be impacting your recovery. Following a demanding 25-year career in marketing, Sam was diagnosed with post-viral chronic fatigue syndrome in 2013. This was in addition to having Hashimoto's disease. She was disappointed with the lack of support from conventional healthcare, and this inspired her to study nutritional therapy at the Institute for Optimum Nutrition. Putting her training into practice and aided by her own recovery, Sam is passionate about helping others unravel and address the many potential causes of their fatigue so they can increase their energy and reclaim their lives. Sam knows what it feels like to be barely able to function due to fatigue and to wonder if you'll ever work again and whether life will be ever the same. But she also knows that with the right help, improved energy and quality of life is possible. Trained in a functional medicine approach, highly personalized, holistic, and science-informed, Sam's particular areas of interest are thyroid conditions, chronic fatigue, post-viral fatigue, and long COVID. Her approach recognizes the interplay of digestive, endocrine, nervous, and immune systems in these complex conditions. Sam is also a referral practitioner with the chrysalis effect, a chronic fatigue syndrome and fibromyalgia recovery specialist, and a member of the Thyroid Collective founded by Jules Chandler, the thyroid expert and a trauma-informed coach. With all that being said, let's jump straight into this episode and find out whether one of these big 4 might be hindering your healing. Sam, it's great to have you here.
Hi, Nicole. It's great to be here.
Yeah, so today we're going to be looking at these 4 root causes that can really kind of hinder your healing and hold you back in a way that maybe people don't realize that they are doing so. And we're going to look at trauma. We're going to look at infections and viruses and the mycotoxins. I think we should kick off with the trauma because I know that that's an area for you that has been something that you've looked into a lot, and recently sort of done a course in and things like that. So tell us a little bit about the work that you've done with trauma. Let's start there. Let's start with your story and sort of how you got into doing this side of things.
I've been working as a nutritional therapist now for nearly 4 years. And shortly after I graduated, I did some additional training with the chrysalis effect, which, as you may know, is an online recovery program from ME chronic fatigue. So I guess that's where my first insight into the role of trauma and ME chronic fatigue development came about. So I started to learn about it there. I think over the years, I've started to see it more and more in my clients. And earlier this year, I did a trauma-informed wellbeing coaching course, which is not about helping people with the trauma, but it's about recognizing it in the things that people say, what they present in their health history, the way they talk about themselves. It can be really revealing. So it's about recognizing potential trauma in people and being able to open those conversations with them and to see how much that might be contributing to their symptoms. I think in my experience, it has come up in the past where I'm working with someone and they're not making the progress that I would like or that they would like. I'm always very clear that it's slow and steady wins the race. We're looking for an upward trajectory. There'll always be little lapses, but I find people who are going up and down like a yo-yo or swinging from good periods to bad periods, that's when I start to think, what else is going on? What's blocking this person? So that's why I did the course. And I've seen it a lot at the moment. And many of the people I work with have got long histories of being ill. And when we delve a bit deeper, there's a lot that goes on. And crying in the consultations is always a big sign as well.
Yeah, and it happens. That does happen, right? But I think as well, because I think just so that we're kind of clear for the listeners as well, there's different types of trauma as well, because we've got the physical trauma that we sort of think of in terms of your, injuries, accidents, that sort of thing. That might be what comes to mind for a lot of people.
Mm-hmm.
There's then that sort of emotional trauma. So if there's been any feelings of neglect or, anything in their childhood that they felt, things like that. And then there's that psychological side as well, that sort of severe stress, trauma. And like you've said, particularly because obviously we're working a lot with people who have health conditions, there is that sort of trauma around your health and around how even if you're healing, around how you've been in the past to how you are now. And I know just before we started recording this, you were just telling me a little bit about your sort of story recently with trauma for yourself. And I think that's as well really interesting. So why don't you just tell us a little bit about that?
Yeah, well, I think as I've learned more about trauma and the impact, and as you mentioned, there's lots of different types, and we often talk to clients about big T trauma, so the things you would expect, like living in a war zone, being in a car crash, abuse, and those smaller T traumas, death of a loved one, bullying at school, etc., and not to underestimate any of those traumas. And what fascinated me looking at the research was that it just didn't matter what kind of trauma it was, it still increased your risk of chronic long-term illness by the same percentage. And I think as I was doing the training, we go through looking at ourselves as practitioners, what might be our hidden traumas that are unresolved. We work with timelines, of course, so we're looking at what's happened to people in their history. And I did some trauma work last year, and often people have had lots of talking therapies, for instance, and I have had in the past with relationship issues predominantly, and many of my clients have had therapy, CBT, etc., but they're still not feeling where they want to be. So in terms of the trauma release that we're looking at, is that subconscious, it's locked in our subconscious, or it's locked in our body. And I did some trauma release work October, November last year, and it was really helpful. I was being activated by certain things people in my family were doing, and it was a bit of a PTSD kind of fear kicking in. So I had some matrix re-imprinting, which was wonderful. And again, a lot of that kind of fell away and I felt much better. But recently, I guess in the last couple of months, I, like everyone, had the cough that was going around for ages. I had a virus in February and had a virus back in November. And I was just feeling like I wasn't getting well properly.
Yeah.
And I thought, that's a lot of viruses for me in 6 months. That's very unlike me. And again, I work in this area, so I'm questioning all the time. I was also having a lot of kind of, the tiredness had really got worse. I've had more headaches. My brain just was going to pieces. And I thought, maybe it's the menopause kicking in. I'm 52 next month. I thought maybe this is escalating. So I went and did my hormone testing. And, I was looking at different supplements to support those kind of menopause symptoms. Like many of us, I see my own practitioner. I have done for many years. She's a naturopath. She's also a kinesiologist, and she does a lot of muscle testing. I went to see her, and she did some muscle testing on me. And she said, "Oh, your hormones are fine, but your adrenaline and your serotonin are through the roof. So what's worrying you?" And I was like, "Well, work's good and family is good." And she said, "Well, something's bothering you." And I said, "Well, I'm a bit annoyed that I'm not back on my feet." And even my husband was saying to me, "I'm really concerned because you look and sound like you did when you were really sick with ME chronic fatigue." And she said, "Well, what's really, really bothering you?" And as I said it, I burst into tears. I said, "I'm really worried I'm going back to where I was." And she went, "Well, there's your trapped trauma." And interestingly, I hadn't actually discussed that in my trauma release therapy that I was doing because it wasn't an issue then. And even just having that recognition and someone pointing it out to me, the next week I felt so much better. It was almost like my body and brain kind of went back online. A lot of the headaches disappeared. I went and did some TRE exercises with a practitioner I know. I had another session with my practitioner, and a lot of those symptoms that I thought were menopause related have disappeared. Yeah. So had I gone to the doctor with that picture, it would have been, "Here's your HRT, off you go," which could have theoretically made me worse in some of those areas.
Yeah. And I think that's one of the big common ones that we see, isn't it? Is around the health trauma. If somebody has, maybe when they first come to see us, it's that sort of fear of never going to get well. I think that can be a trauma in itself, because maybe they've not got through that journey of feeling better. Or it's somebody that's coming who is on the journey, they've sort of done something, maybe researched themselves and things like that, and they've done some things and they're starting to feel a bit better. So they've built that confidence that actually they are feeling a bit better. But a lot of the conditions that we both work with can have relapses or flare-ups, whichever way you look at it. And I think sometimes people start with that flare-up, and a lot of that you start to see a lot of that trauma. It's that, oh my God, I'm going back to square one. I'm going to be back where I was, and I'll have to start all over again, trying to get better. And that is, and people, but I think that's the thing with trauma, is people don't recognize that really as a trauma. Like if you said to them, have you been through a traumatic experience? Their answer probably would be no. There's not that many that I think would actually turn around and say, yes, that's a traumatic experience. They just kind of accept it as part and parcel of what's been going on for them, and they don't sort of see it as a traumatic event.
And I think also, I work with a lot of women, and I'm sure you do as well. You have a higher risk of autoimmune disease. Yeah. And we are often caretakers, especially the kind of age group I work with. They have aging parents, they have kids, they have a job, they have a husband, they have a house, several pets. And we're almost programmed to kind of just get on with it. I know I grew up with a kind of, just get up and brush yourself down and get on with it kind of attitude from, my northern parents. So that's what I was brought up with. It just pushed through. And again, that was a big part of my post-viral chronic fatigue diagnosis. I had a couple of viruses back to back, pushed through, went back to work, and started collapsing 6 months later. I mean, there's a lot more to it than that in the run up to it, but I didn't stop and recover, and paid the price 6 months later.
Yeah, and I think that's the thing, because trauma is very linked as well to, in terms of how it sort of impacts our body, it's very linked to the axis. It's very linked to that sort of stress response. It really does force that sympathetic nervous system to become overactive, get stuck in that kind of fight and flight response. And that in itself, we know the link between that response, that fight, being in that chronic stress fight and flight response, and developing chronic illnesses of various types, from, the sort of the diabetes to the, heart attacks to the autoimmune diseases, to even to as far as cancers. There's lots that can come up from being in that stress and having that HPA axis dysfunction. And trauma is that's one of the things that it does, right?
And then obviously we have the fight and the flight, and we have, many of my clients are in that kind of free state where they've just kind of locked and they're kind of numb to most things. And again, kind of moving from that out of the back through the other states can take some time as well.
Yeah, I think it is tough when somebody's been going through a health condition, because I think they get so focused on the physical aspect of recovering that they forget about the emotional or psychological side of recovering as well.
Yeah. Interestingly, I am working with 3 practitioners for their own health reasons, and 2 of them have got quite a big kind of trauma picture going on as well. And much like myself, often we need we need somebody objective to be looking at what's happening with us, to kind of point out things that we don't necessarily recognize in ourselves.
Yeah, and there's obviously the the diet, some dietary things that we can look at in terms of trauma and stress particularly.
Yeah.
But what about things like, dietary wise, that anti-inflammatory diet, obviously great for this sort of, getting plenty of the omega-3 fatty acids in there, magnesium and things like that are very good nutrients for it. So there's that side of things. But what are the other things? So sort of what other things would you use with people, or recommend that people look at with other types? I know you've mentioned a few different types of practitioners or sort of therapies that you have there. What are the other things that you would sort of suggest people look at using for trauma?
Well, like you say, it's often about supporting that HPA axis. And obviously when we are in trauma, if we're in a fight and flight response, our bodies are going to be draining all of those nutrients even more. So the need is much stronger for things like magnesium, I use vitamin C a lot as well to support the adrenals, and also fits lovely with the immune system. B vitamins, again, working with chronic fatigue, energy is an issue, lots of, emotional and cognitive health issue, and we need B vitamins for absolutely everything. So those would be the big threes for me supplementally. But I also using more and more now kind of the medicinal mushrooms for their adaptogenic properties, and some really nice adrenal complexes or nervous system support. I have clients who, and obviously some stress that we can't get rid of. I have clients who are looking after elderly parents with dementia and traveling for far distances. So there's certain stresses that we can't remove from life. So I say to my clients, we're never going to be stress-free. It's going to be impossible. So it's about making ourselves as resilient as we can be.
Yeah.
So a resilient immune system and a resilient nervous system will help us manage those stresses as and when they come. So those things like theanine, I love theanine. I use it myself. It's nice and cheap. It works quickly. It's great for that racing mind in the middle of the night. It's on my bedside table, and it doesn't interact with medications very much from what I can see with the clients that I've worked with. And, it's a real good one for kind of calming things down when you need to, but also keeping you alert in the day. It's not sedative. But then outside of supplements, the usual, as you say, prioritizing sleep, prioritizing rest. Journaling can be really helpful for people to kind of recognize when those negative thoughts are coming, just to kind of stop and think, oh, that's just a negative thought. So lots of different kind of lifestyle practices as well as the good old breathing. If nothing else, focus on your breath, longer out breath to calm back to the parasympathetic nervous system.
Yeah. As we said, people are so focused, particularly when they've got things like chronic fatigue, they're so focused on physically getting well, but actually working on emotionally getting well has that knock-on impact on your physical health. We can look at them separately. We can look at your physical health and we can look at that recovering emotionally as well. But actually, I think people miss that concept that by working on that emotional health, you are physically helping yourself too. Like you've just, you mentioned in there, calming calming that HPA axis and getting all of that out of fight and flight, bringing in the parasympathetic nervous system. That all helps with your immune function.
Yes, absolutely.
It's a knock-on effect with everything. And so I think, obviously I work a lot with the autoimmune conditions. I know you work with as well, but that balancing your immune system is vital if you're going to be working on anything with autoimmune.
Absolutely. Yeah.
If there's that, and that's where that trauma picture can kind of come into the autoimmune picture.
Yeah. And I think it's such an important area that I now mention it in my discovery calls with people. Obviously, I don't open the conversation there, but I do, much like, when people say to me, how long will it take to get better? Impossible to say. I'm here to support and guide you. I can't do it for you. And everyone is different. But especially, sometimes I can hear it in the things that they say, but just generally, I tend to be very upfront about it, so people know that rather than 3 months down the line, if they're not making progress, I do make it quite clear that if there is trauma in your past and it's unresolved, it could be stored in your body or subconscious. I find in my experience that it can be a real block to healing for a lot of people. And I think then, and more recently, I'm opening those conversations sooner in the programs as well. I use a couple of very simple questionnaires for ACEs and also for a highly sensitive person questionnaire, which is literally just tick a few boxes. And I think sometimes when people see that in black and white, they go, oh, yes, yeah, maybe this is contributing. So I find those really useful little tools that can help people start to kind of think about things in a different way.
And do you find people are reluctant to accept that trauma might be part of the picture?
Not really in my experience, but I think that might be more indicative of the kind of people that I work with when they have done a lot of work themselves. They have done lots of research. They've tried lots of different therapies. They've tried different programs. It's very rare I see a poor food diary. Some food diaries, I can't actually change anything. They're doing all the things that I'd recommend. So they've been all around the houses and they've tried everything. So they tend to be aware of it. They're maybe not so much aware of, there's lots of talking therapies happening. They're maybe not so much aware of the fact that it can get tracked in other ways and that there are alternative non-talking therapies that might be beneficial. And when I talk about some of them, they're like, oh, that sounds really good. And I've tried a lot of them myself.
What sort of things would you recommend with those?
The TRE, the trauma release exercises, I think they're really useful. And that's about, it's often called the shaking therapy. And it was designed, my understanding is it was designed by a scientist who noted that after car accidents, children would shake. Obviously, traumatized, they would shake almost like they were shaking the stress or the adrenaline out of their bodies. Whereas adults, we're taught to say, oh, come on, everything's fine, and we hold everything in. So it's about, I say they're exercises, they're more movements, really. It's very gentle, and it's about warming up your muscles. And then the shaking, it's quite an unusual feeling, but afterwards you feel very, very relaxed. And I took my husband there last week to the local practitioner, and he looked like he'd had like 7 years sleep when he finished. He was so relaxed and chilled out. But yeah, there's no talking involved. It's purely a movement thing. I have tried EDMR, but I didn't really get on with that. And tapping, I've done some tapping as well.
Yeah, and I think that's the thing. I think that people need to recognise as well is there is no necessarily one right, therapy.
Exactly.
Everybody's different, and it's what works. It's what works for you, right?
Yeah. And much like we do, the trauma therapist will always have like a free intro call with people. Often it's about, do you gel with the practitioner regardless of what their therapy is? I think one of the practitioners I went to gave me a little taster session in the session so you can actually experience what it might be like. So I do encourage my clients who are interested in progressing to speak to a number of different practitioners. And I often say now, I find myself saying, if it feels right, it probably is. And conversely, if it doesn't feel right, it might not be right for you. It might not be right for you at this point in your journey. But yeah, I guess for me, it's about opening the conversation when it's the right time to do so, when people are ready, but also kind of going at their pace. And often people will go away and think about it, and then they'll email me, say, yeah, I really resonated with what you said, Sam. Can we talk about this more next session? So I have to approach very gently and sensitively with these kind of issues as well.
Yeah, but I think it is really important to look at because, as we said at the top of this when we started, these are things that can block people from fully healing to the extent that they want to. It doesn't mean you won't get better at all, but we're thinking about those things that can kind of hinder you from getting those results that you really want to see. What could be the things that you said, people come to us and they've got, how many times I see like a really perfect food diary, and things like that, exactly as you've said. And, you sort of think, so there's got to be something else. What else is it that could be blocking that healing? That's the things that we're talking about today. And so these conversations have to be had with people. And like you said, approaching it the right way, but they're really important conversations to have.
Yeah, and often I do say to clients, if we get to a point where things aren't moving, we have these conversations, and I don't send them away, but I say to them, in my experience and my opinion is, you would be better off investing your health budget into some of these therapies if you're open to it, rather, because we could continue, but there'll still be this block. And often they go away for 3 months and they'll have some different therapies. And then when they come back, I can see immediately just on Zoom how different their faces look. They change people. The other thing that comes up a lot as well here is sensitivity to supplements. I find is if people I've had people react to magnesium, really odd things that you would be calming. But if people are very sensitive to supplements, I always feel like it's the nervous system saying, I don't know what this is and I don't like it. And it almost kind of stresses them out. And then they stop taking it and they feel better. But then when they reintroduce it again, the nervous system's a bit, oh, I know what this is now. And it's a bit happier. But that kind of supplements don't agree with me can often be a potential sign that there's underlying issues to be resolved.
Have you ever used any of the tools like the Sensate, which for people who don't know is sort of a little egg-shaped box, I guess is for want of a better way of describing it, that sort of sits on your chest, and it's uses vibrations effectively to help to calm the nervous system, works on vagal toning, I suppose. Have you used any of the things like that?
I'll tell you a story. I ordered my Sensate probably about 3 or 4 years ago, and I was really bad at using it. Like many of us are women practitioners, we've got lots to do, always on the go. And I use it intermittently, and I never really got into a good habit until recently. So in the last few months, I have been getting into it and much more. Just with everything I've been going through, I've been using it more. I got the extra there's extra tunes that go with it. There were some really nice ones in there. And I'm really noticing the difference now with that regular use. So I've started to recommend it to clients. I also recommend, those vagus nerve exercises, the Stanley Rosenberg ones where you're moving your head and your eyes and twisting your spine, etc. Because again, they say exercise is more like movements, but for someone who's very tired, you could do those lying in bed, for instance. So I use those as well as a gentle introduction.
Yeah. I've had some good results lately with the Sensate, and that's something that I've sort of added to the toolbox, I guess, for this sort of thing. And they are, we'll link all of these things we're talking about. I'll link below the episode so people can find nice and easily. So let's move on and look at some of the other things that can be blocking our sort of recoveries. But let's look at viruses or infections and viruses. I guess we can kind of talk about them together to an extent. Infections, we're talking bacteria, viruses, fungi, parasites, all of those sorts of things that can pop up. And viruses, I guess we're talking more, I think probably the most common ones I see, we're probably looking at the HHV6, Epstein-Barr, cytomegalovirus I see a fair bit of. So they're the sort of things that we're talking about. Let's start with infections. Do you think they get recognized enough in the work that we do? I know it's something, I do quite a lot of work with infections and viruses, but do you think people always relate to the fact that there could be something there from quite a look? Because these are things that can reactivate, right? Particularly with the virus, like Epstein-Barr, things like that can reactivate. So I think sometimes I feel personally that sometimes people almost miss that connection because maybe it was something that they know they had quite a long time ago and they haven't necessarily linked it to what's going on now. What's your sort of experience with that?
Yeah, I think people are very aware of acute viruses, whether it's COVID or a cold or norovirus, that you get something, you feel ill for a couple of days, a couple of weeks, and it goes. And I think that's often then people's kind of understanding of viruses, that it's gone. Obviously, we know differently that they hang around. And I spent many times shouting at the TV in the recent years with, we will defeat the virus, we will. And like, well, no, viruses' only role is to survive. And they're quite happy setting up shop in your body and wreaking havoc on your health. So I find that clients, it doesn't seem to be high on their kind of agenda that these chronic viruses can exist. I guess when I have a discovery call and they talk about flu-like symptoms, that's a big kind of warning sign. Yeah, I feel fine for a couple of weeks and I just feel really run down again, and I do this, or I get everything going. Again, sign of poor immunity. So I hear that a lot. I think more recently with COVID, with the infections, but also vaccinations, there's a lot more evidence and clinical feedback coming back that that these viruses and things actually reactivate dormant viruses. But I also point out to my clients, this is a new thing. Yep. So shingles is your chickenpox coming back. Comes out in times of stress. I'm seeing a lot of shingles at the moment, interestingly. EBV, glandular fever, it's thought that majority of us have it, and that's a biggie that's being reactivated in recent times. I spoke to a young lady this morning who's had chronic fatigue since she was in her teens, 14 years, and that was viral driven. And 14 years later, she's had shingles and ended up in hospital with glandular fever recently. So very obvious triggers there that these things are still lurking around. But also when we're looking at people's questionnaires and health histories, you can see I had tonsillitis all the time. I had all the penicillin, which was my journey as well. I read recently that recurrent tonsillitis is now considered glandular fever, not tonsillitis.
Yeah.
And again, all the penicillins, all the antibiotics doesn't go away because it's not a bacteria, it's the virus. So that health history can be really, frequent chest infections is another one. I see that quite a lot, from childhood all the way through. So
sinus infection is the other one I see quite a lot, recurrent sinus as well. I had a client recently, she was a doctor actually, and she obviously coming up within the workplace, coming up against obviously bound to be coming against a lot of sort of viral infectious things. And they thought she had rheumatoid arthritis. So that's what, going to the doctor, she was a doctor herself, and going to the doctors, that's what they were sort of getting ready to diagnose her with. And she was, struggling to walk down the stairs, really really having really bad joint pain and joint stiffness and problems with that sort of thing. When we got into testing, she came to see me because she wasn't sort of getting the answers that she wanted. When we ran some testing and we found HHV6, we found some of the reactivated viruses, we found cytomegalovirus. And these things were all things that, weren't current. They weren't in her, she hadn't been ill in the last few weeks to cause this. These were all things that were from her past that had probably through stress, because she had obviously had a very stressful job. She'd been through COVID being a doctor. So, it was, there'd been a lot of stress in life. And she'd had these sort of reactivated viruses or low viral loads that were just there sort of ticking along. She had a couple that had reactivated and the levels were quite high, but some of them were just so ticking along, bubbling along underneath, but were still high enough to be classed as, you've got this viral infection there.
There's activity, yeah.
Yeah. And as soon as we got that, worked on those viral infections, we found there was some of that actually, she ties in perfectly with this episode, because the other thing that she had was mycotoxins. That's the other thing we found was molds within her, and which we're going to come on to in a moment. But as we worked on those and we dampened down, she had a bacterial infection in the gut. She had this low viral load. She had the mycotoxins. She probably had trauma as well from working as a doctor through COVID.
Yeah.
And so she had sort of all of these things that were all stopping her from healing. And as soon as we worked on those, I mean, she's now, she's on hiking holidays and it's absolutely fine. And she doesn't have rheumatoid arthritis as it happened.
Yeah.
So a bit like with the, if you'd have gone to the doctors, you probably would have been diagnosed balls and put an HRT.
Yeah, that those kind of symptoms that you don't. I was thinking about, what are the symptoms of a chronic virus rather than an active virus? Because people know what you feel like when you get a cold.
Yeah.
But obviously, those flu-like symptoms, headaches, that kind of, viruses like to live in the nerve, so that kind of nerve pain.
Yes.
I had a client last year, a very, very high-flying executive on the go all the time, crashed and burned. Ended up in hospital before we could actually do our first session because the pain in her arms and legs was so astonishingly bad. She thought, she was really, really scared. Spent a week in hospital. She had an MRI, which ruled out MS. She asked the doctor about ME, chronic fatigue, and they just looked at her blankly. The neurologist literally told her it was all in her head. She also had episodes of Bell's palsy when the face kind of droops on the side. And then when we finally started work together, and I said, well, this looks like a very viral picture to me. Viruses are associated with peripheral neuropathy, that burning arms and legs, and also with Bell's palsy. And actually we supported her immune system and brought in some antivirals, and those symptoms cleared quite quickly. Although she'd been put on very, very strong painkillers, which fortunately she wasn't on for very long, but she was able to come off that because the symptoms reduced. But that was an extreme example, but yeah, still happening, unfortunately.
Yeah, and these viruses, again, they have this knock-on effect because some of them, like we said, they remain sort of latent within the body. Once you've had them, they're there all the rest of the life, and then they can reactivate under certain times, particularly like you said, through stress. We have those sort of persistent viral infections that can, essentially what they're doing is leading to that chronic inflammation, which to that immune system dysregulation. So we've got that, I'm catching all the colds, getting sick all the time, that sort of thing. And then you've got that sort of long-term viral presence that can actually act then as a trigger for something else. So like particularly for the autoimmune diseases, we know that
absolutely.
Can act as a trigger for sort of autoimmunity. So there's lots of knock-on impacts as well from having viruses in the body, isn't there?
Yeah, I mean, I've got a couple of younger clients, one of whom is 10, another one who's 19, who had a very clear picture of getting COVID, getting vaccinated, and even the 10-year-old now has positive antibodies. So she's got Hashimoto's, and she had it in the family. And I suggested to her that she strongly pushed for the doctor to actually test the antibodies, and they came back positive. And similarly with a 19-year-old, again, very clear triggers in much younger people, makes our lives a little easier, but very clear triggers where, the thyroid condition, the autoimmunity has been the kind of net result for them. I had
a client that came to me and sort of said, she actually said to me, I think I put this up in a social media post, actually, I think it went on Instagram. And she said to me, one of the things she said to me was, the kids keep making me sick.
Mm-hmm.
As in, they're bringing they're bringing colds home from school all the time, and I keep getting, well, that was what she meant. But her words were, the kids keep making me sick. And I and I turned around to her. I know her quite well, so it's fine. I turned around to her and I was like, no, the kids don't keep making you sick, because you should have, as an adult, you should have the immune system that can cope with that. Your children are coming into contact with new things all the time, and they are supposed to get sick from them, and then that goes into their immune memory, and they don't catch them again. That's meant to be happening with them. But you're, as an adult, you shouldn't be catching these things all the time, and they're not making you sick. Actually, you're not looking after your body well enough to build that resilience to stop you from getting these things. It's actually not your kid's fault. We're going to blame you instead, sort of thing. And and it really kind of hit home with her, because I think we're all guilty of this, and I'm not blaming her for this, but we all make excuses. We do, don't we? We're all, the kids are making me sick, or I've got a lot on with work, I'm just stressed, I'm just tired, I'm just busy, whatever it might be. We're really good at making excuses for the niggling things that go on underneath, aren't we?
Yeah. And I say to clients very bluntly, well, stress of any kind is an immunity killer, basically. If you're stressed out, your immune system is going to be on the floor, and you are going to catch everything. And much like we talked about the HPA, when that and your nervous system activated, draining all those lovely nutrients you need to basically be well. If your immune system is also activated, but there aren't any nutrients left for your immune system, it's like trying to start a car and you're not mounting an immune response. So when I'm working with clients, I'm looking out for things like, oh, my son had a chest infection for 6 weeks, but I only had it for a couple of weeks. And well, that's progress for somebody who, a year ago was literally on the floor all the time. So again, back, you've got the nervous system resilience, but also that immune resilience, which is about helping your immune system to actually, do the job better for you. If you have a virus, you don't go to the doctor to get an antiviral, do you? They just don't exist. Not to the general public. Maybe for shingles if you have a formal diagnosis. But we've got antibiotics, but they're not going to work against a virus.
Yeah.
So I think we have lots in our toolbox that we can support those viruses, those chronic viruses with as well.
Yeah, I talk about that actually in my book that's coming out in November. I talk about the difference between what we're talking about when we say immunity and what we're talking about when we say immune resilience, and how actually immune resilience to me is the more important thing.
Absolutely.
It's
absolutely
building that in the same way, exactly as you said, in the same way as that nervous resilience. It's building your body's ability to cope with things, because we can't, as you said at the beginning, we can't remove everything. We can't just say, like, you're not going to have, I've had this recently. My mom's not been well, and that was very sudden. And it's, I can't just remove that stress from my life. I can't just sort of say, oh, I'm not going to deal with that. I'm not going to get stressed. It's not going to happen. I'm going to be stressed about it. The question is, what am I going to do to help build that resilience to it, that nervous resilience, the immune resilience? What things can I put in place to help me to get through that time where I've got stress? And that's really what we need to do, isn't it?
Yeah, and it's coming back to that, that kind of, we say it quite a lot, I'm sure you do as well, is about listening, being better at listening to your body. It's telling you what you need to do. If you're tired, it's telling you need to stop. And often we're very good at ignoring those kind of signals.
Yeah. And what about the infections? What are the most sort of common ones that you're seeing infection-wise?
Well, I guess what I do when I suspect infections or viruses, again, some simple questionnaires. I love the questionnaires from AONM, the Academy of Nutritional Medicine. They've got 2 or 3 different ones. One is a post-COVID one. But what it does is it's tick boxes to tick the symptoms that you have or have had previously, and it creates an algorithm. So, well, these symptoms you've ticked link to this virus or to this bacteria or to something else. So you've got your herpes virus family, you've got your gut viruses, your Coxsackie and your enteroviruses, you've got your pneumonia bacteria there. Often I use those with people, again, very early on in the process. Just tick these boxes and let's see what it says. And it's not diagnostic. It might just give a sign to say, well, actually, your number one ranking infection is actually looking like pneumonia, or it could be Lyme disease. And what I found when I have tested people, that it's always a mixture. There's usually a virus lurking around. Coxsackie comes up with everybody I've tested. And I think it was Dr. Armin Schwartzbach said in one of his webinars that it's the most common virus in the world. But who's ever heard of Coxsackie? Potentially no one. I had a lady cut score quite highly with pneumonia, and it came back positive in her test. And she went, do you know what? I remember being told that I had pneumonia scarring on my lungs, but I don't have any recollection of having pneumonia. But she obviously had a scan at some point, so made those kind of connections. So I often see them all together that way. And I know Dr. Sarah Myhill, kind of famous any chronic fatigue doctor or ex-doctor now, she basically says, well, if you've got one infection, there's going to be more than one because your immunity's on the floor. Yeah. So for people who can't invest in the testing for whatever reason, those questionnaires can be a good indicator. And often I use those to prioritize what support we might put in. And, it can really bring some relief.
Yeah. And I think that's it, isn't it? That, that sort of brings us nicely onto the last one we were going to talk about, which was the mycotoxins, the mold, because, as I said, with the patient I was talking about earlier, she had the viral load, she had a gut bacteria overgrowth, she had the viral load, she had the mold, as you're saying, often these things.
I had one of those as well. Yeah.
Yeah. So, and mold really, I've been inundated with mold in clinic recently, in sort of since COVID, really, to be honest, in the last sort of few years. It's really been something that has come up a lot with clients, and it is there's a lot, there's lots of different ones, and obviously they're all quite different in terms of what parts of the body they can impact. I'm seeing particularly a lot of ochratoxin A comes up a lot, which is what we call the persistent mold. I've talked about this on the podcast before. There is actually an episode on mold, particularly when we dig into ochratoxin A. But it is something that I'm seeing a lot. And it's something that I think, again, people don't necessarily recognize. And you miss it. It's like, all of a sudden people will be talking, they'll be like, oh, do you know what? Actually, I did have a leak, a few years ago in the house, and we got it fixed and sorted it. And and then they kind of think, well, that's it. The leak's been fixed, because usually things come from water, can come from food, but most commonly, particularly in the damp environment we live in, most commonly the water damaged buildings, aren't they? But I think people think you've kind of got to see, big patches of black mold on your wall to have it. And that's just not the case, is it?
No, and I think it's, I think the other thing that people think, well, yeah, but I moved out of that property 20 years ago. And it's not so well known that you can actually, if the spores are in you and kind of taking root, if you like, you can be taking those mycotoxins with you. So they again, it's not acknowledged. Or student flats is another one that comes up quite a lot. And I had a lady who, we renovated our damp basement into the kitchen, so I spend loads of time in there. But I have had clients who have redone their bathrooms and then found the black mold underneath the bathroom tiles somehow, or they've moved a wardrobe and there it's behind the wardrobe where they thought they checked everything. So it's like you say, it's a bit like those chronic viruses and the trauma. There's often not that kind of awareness. You're absolutely right. We live in a very wet country.
But it's
unsurprising.
It doesn't need to be a wet country. I was reading about, I love looking at houses and interiors and things like that. And I was looking at, I think it was Gwyneth Paltrow. They had a article on her house that she'd done up, which was in California somewhere, in LA, I presume. It was definitely in California. And she'd done renovations, and she'd done the best of the best. She'd imported Italian marble and, all the full work, as you would expect her doing up a house, and it was beautiful. The house was lovely. But she kept getting sick and she couldn't work out what it was. And in the end, she got like a functional medicine doctor in and trying to figure out what it was. And in the end, he said to her, you're going to have to rip out this beautiful Italian marble bathroom that you have just done, which was stunning and I'm sure highly expensive. And they found it was literally under the bath, under the marble. It was like, so she was literally sitting in the bath. She said she was sat on top.
Oh my God.
Basically mold. And this had been renovated. So this was, it was even deeper down than where they'd done the renovation that they found it. But that just, to me, just sort of showed you don't actually need to be in a wet country.
Yeah.
You definitely don't need to be able to see the mold, because this room had already been ripped out. So this was under where they'd, sort of done renovation work, and it was still coming through, and it was still impacting her health. And it's amazing really how much they can impact you without necessarily seeing them or knowing they're there.
And I think as well, a lot of the symptoms, I think it is mold or mycotoxins that people talk about it as the great pretender. It can look like lots of other different things, and even if you take the viruses and the infections in, again, a lot of those symptoms overlap. So it can be a real mindful to figure out, which symptom is related to that. So sinuses, for instance, is a big one that comes up with mycotoxins, but people are like, oh, I've just got a bit of a cold, or I get hay fever. I had a client when we brought in an antifungal nasal spray. She went, I felt better within 2 days. So, after this, normally you wouldn't have an antifungal nasal spray, but for her, it was a relatively cheap way to actually think, well, actually, that's what's going on in your nose. Let's try this spray for £15. And it was a bit of a game changer for her. But that's, I guess, where we come in as nutritional therapists, that detective work that we're doing and again, looking at everything holistically, because everything is connected. That often this is where all of these things can coexist in the same person at the same time, because we've got to heal on a kind of holistic level, and then you kind of get some relief of those symptoms. I've got a client at the moment who actually did test positive for Lyme and Coxsackie and something else I can't recall at the moment. Lots of digestive issues. And last time I saw her, she said, "Oh yeah, my flat sprung a leak and there's black mold everywhere." And at that point, she mentioned it had happened before, and she'd never mentioned it before. So it's quite possible she'd been exposed for the last few years. And again, she is swinging, a good couple of weeks, then she falls back, etc., etc. So yeah, we're trying to get her away from the exposure at the moment, because obviously already her system is quite delicate dealing with everything else she's dealing with. So, but yeah, that is rare. It's rare to see that in the one person, but it does happen, I think.
And it's a bit like the viruses, isn't it? Because particularly with mycotoxin A, which I see a lot, it's what we call a persister mold. So it actually binds to, like you said earlier, people think, oh, well, I've moved out of the damp building, so I'm okay. But, it's this persister mold. It binds to a protein in your blood, and then it is traveling around your body, and your body's not going to expel your blood because you need it. So it's in there until you actively do something to remove it. And in much the same way that these latent viruses can live there and sort of bubble along and reactivate at times and things like this. So, all of these things can kind of be, even the trauma. I think even if you do that, all of these 4 things that we're talking about can all kind of be there underneath, bubbling away with necessarily really realizing it.
Yeah. And I think the thing that surprised me most when I first started working with mycotoxins and is the fact that obviously mycotoxin, penicillin is made from a mold. So if we've got mycotoxins in us or spores in us, we're effectively making our own penicillin. So, it's effectively just destroying your good gut bacteria, which you need for your immune system. And one of my clients had lots of tests, loads of tests with lots of other practitioners, but nobody had tested her gut at all, which I thought was really unusual. When we tested her gut, her beneficials were almost non-existent. There were whole bacterial families that just weren't there. So then we've got to look at a kind of a gut support, immune support in parallel with the detox, obviously very gently, of managing the toxins. So again, if you've got mycotoxins, it's going to destroy your immune system potentially, which makes you even less resilient to other infections. And again, add a whole load of trauma and stress on that. And, it's a very difficult kind of picture, and hence why we need to look at addressing those underlying drivers wherever we can.
Yeah, I think that's really important. I think that's really the main message, I think, to people from today, isn't it? To be able to recognize that these things could be going on underneath. If you were going to leave people with sort of one message, from this episode, from what we've talked about, what would you want people to walk away with? What would you want them to be able to recognize in themselves, or to be able to do about these things?
Well, I think the one is the difficult to find one. I would say not to be disheartened, because if these things are issues for you, there are lots of things from a nutritional therapy, functional medicine point of view that we can do to support these different areas. I guess that's where it can be beneficial to work with a practitioner who will do a lot of the legwork and detective work, and that, how does this link to that, etc. What do we do for you in the right order for you, because everyone's unique. But yeah, it's there is plenty that can be done. But I think that we've talked a lot about resilience, and that's often what I say to clients is we want to build your resilience from the gut immune system upwards, effectively, if you like. So, and there's lots that can be done with with food, with lifestyle measures, with good supplements, etc. Testing is not always necessary, and often a lot of people are unable to do that. But I do love those questionnaires, and there is a mycotoxins one as well that I use quite a lot, which can help identify what can be a key driver for you.
Yeah, I think that's a great message, and I think it's really important to have the conversation today because like you said, it can be very disheartening if you are trying to recover and you're not getting those results that you want, particularly with things like, like we work with the autoimmune diseases, the chronic fatigue, those sorts of conditions. It's easy to get disheartened when you feel like, because a lot of people feel like they are doing everything, right? They're doing all the change, all the lifestyle stuff, and they're just not getting better. And sometimes one of these things can be that missing little piece of the puzzle.
Exactly. Yeah. And one of those clients that I mentioned who's just been exposed to the mycotoxins, when we tested her for Lyme and viruses, she'd had the results previously, but when I came onto the session with her, she was really happy. I said, "Oh, you seem very upbeat," and she said, "I'm really pleased. We now know what." So we know, she was happy that she knew that she wasn't going crazy. That there was something else driving some of her symptoms. So that can help people, and some people like to test because they like to know for sure. And, they may have been told for years, "Oh, there's nothing wrong with you. It's all in your head. You've just got IBS," whatever it might be. So, she was quite pleased to get it. It was an odd thing for me to experience, but yeah, it helped her, and also helped her to kind of, make necessary changes and kind of go with the program to, move forward with her healing.
Yeah, I see that a lot when people just want to, it's almost a relief to see something come up on, not that we ever want anything on a test result, but I think for some people, when they've been in that situation where they're really struggling, to see something finally come up on a test result too, not that we should need to have it in black and white, because we should be accepted. If that's how we're feeling, that's how we're feeling, but it's not always the case. Sometimes that it's not always listened to as such, and sometimes for people having it in black and white and just saying, there is actually something wrong. When you're going through, like you said, all these things where it's like, oh, your labs are normal and all of this, it can be really hard. So I think for people to know that these options are there and these are things that can be impacting, it's really important.
Yeah. And I think what these things all have in common, then they don't necessarily feature in conventional medicine. There's very little awareness. There's no research. If you research studies into mycotoxins, you get lots of research papers about animals and chickens and fish, etc. So it happens in animals. But there's very little kind of research, clinical evidence in terms of some of these things and impact on symptoms. So, you might go to the doctor and get a blood test and it will say, yes, you had EBV in the past. Well, that's not what we want to know. We want to know, is it active now? But that testing just isn't necessarily available because conventional medicine isn't set up to give any treatment for those things. It's just the way that it's set up. It's great for lots of other things, but for certain chronic illnesses, it's just not set up in that particular way to kind of really dig deep into what are those drivers of someone's symptoms.
And that's where the functional medicine and the testing can come into its own, isn't it? Because we can see if those things have reactivated and get a better picture. Sam, thanks so much for joining me today. It's been great to have you on. It's been great to have this conversation. I think people find it really, really helpful. We'll link all your details below the episode. So if anybody wants to find you online, we'll put your Instagram and your website and things like that below the episode and some of the things we've talked about today as well. But thanks so much for your time.
Okay, well, thanks for inviting me on. It was an excellent chat and I hope your listeners enjoy it.
I hope you enjoyed this episode of the Good Health Podcast. Do share the episode with anyone who you think it may benefit or who may enjoy it, and help me spread the word by rating the episode or leaving a review. If you want more, you can find other episodes in the series on your podcast app or sign up to my free newsletter. Not only will you get information on new episodes launching, but we cover lots of health topics with the Ask Nicole section where you can send in your questions, my favorite recipes, my favorite products, tips and tricks to help you on the road to good health, and much more. You can sign up free of charge at nicolegoodhealth.com/newsletter, also linked below. I hope you have a lovely week. Don't forget to hit subscribe and I'll see you next time.